Hi, Dr. Hizon, here to talk about lower extremity wounds medical scribing. So there are different kinds of ulcers. They're considered acute if they're within 6 hours. The etiology can be due to surgical wounds, bites, trauma, abrasions, and burns. Sometimes there's chronic ones, and the chronic ulcers are considered over 6 weeks, and they're caused by a lot of mechanical type of conditions, but also etiology diagnosis such as diabetes, obesity, smoking. For example, you can have vascular insufficiency or kidney disease. So these are the classification systems that you might need to document. Stage A is a clean one, stage B is an infection, stage C is where there's ischemia, and stage D is ischemia and infection. There's different Wagner's diabetic ulcer classifications you might be needing to document. Grade O is intact skin, grade 1 is superficial, grade 2 extends to the tendon, capsule, or bone. Grade 3 is associated with an abscess, osteomyelitis, sepsis, and or infections that show up on an x-ray. Grade 4, unfortunately, is gangrene of the forefoot, and grade 5 is gangrene of the entire foot. And so methods of debridement, they might use sharp or surgical type debridement. They might use mechanical such as hydrotherapy and wound irrigation. They might use some medications such as hydrocolloids. They might use enzymatic preparations, and they may even use such things as maggots, which are basically larvae of a green bottle fly, to help to do the debridement. So you have to know the size of the wound, so the physician may tell you the measurement, both length, width, and depth, as well as to look at what the change is over time. And there's different kinds of lower extremity wounds, such as neuropathic, venous, arterial, and pressure. And so the diabetic is a typical one that you'll see quite a bit of, and they're going to want to know how big it is, how long it is, how deep it is. So apologize about the gross slide, but you can have amputation due to this, and they're going to be documenting all of these sort of things, and at last resort, they do have to do amputations. Sometimes you'll have to do different kinds of treatment that you might see, as well as trying to look at ways to control the inflammation with these different sort of agents. And there is a compression therapy called an Unaboot that you might be using. And then with ischemic ulcerations, they may use peripheral vascular consultation to get a vascular surgeon involved, and they may want to use sharp dissection, which is surgery, as well as even amputation. These pressure ulcers are problems on the heel from basically laying in one place. There is shear force due to friction with moisture, and you get deep necrosis, and you can get, as well as you can avoid this due to felt pads, pillows, and wound care. There are vascular ulcers. You can see here, this has some erythematous macular type of lesions that can go along with these sort of things such as lupus, rheumatoid, sarcoid, periarteritis nodosum, and these are usually with an elevated SED rate or some other arthritic type changes. The treatment is usually local treatment of the ulcer, and a lot of times these patients go on prednisone. Sometimes you get radiation ulcers from treatment due to cancer. Sometimes different medications such as 5-fluorouracil or doxorubicin can cause it. Sometimes with drugs of abuse such as cocaine or heroin. Sometimes if they have sickle cell where their blood is different, they can get ulcers due to sickle cell. That can be due to high blood pressure can cause these problems. And then there are some weird infections that can cause it, and sometimes these start with a pustule at the site and then get bigger. You can get this ulcerating squamous cell carcinoma, so a skin cancer can cause some of these. And you can get it just from a puncture. If you, like this, someone got punctured, stepped on this nail that went through the foot. And so you may be looking at what we're going to be looking at in terms of the classifications for this and the high rate of what's called osteomyelitis or bone infection. And then again, there's different kinds of bacterial processes which can be due to different things. Remember, human bites have this Echinella corrodens, cat bites are Pasteurella multifida, which is a bacteria that's common in cat bites, which are puncture-like bites. And dogs get Enterobacter, Pseudomonas, and staph infections. And these are treated aggressively, antibiotics, eye infection, and drainage, or irrigation and drainage. These are the different products that they'll use for wound care. And we may want to use some of these other type products, so you'll see these being talked about. And in general, the thought is that you want to be sure that you come up with what is the treatment. So in documentation, these are the things they're going to want to know is what's the etiology, what caused the infection, what's the size of the infection, how are they treated, and the rationale for doing that, as well as all the precautions that they give them. So I hope this helps you to do a medical scribing for wound infections. Thank you very much. See you next time.